Well, good evening to all of you. I think one of the first things I'd like to do is recognize one of our elected officials here with us tonight, Commissioner Will Tucker. Will, good to see you. Thanks for taking time out of your schedule and joining us. And I oftentimes like to have an opportunity to recognize folks that work throughout the community daily to help make good things happen. And Commissioner Tucker, I got to tell you, you and your colleagues have been very, very helpful at helping us to get this thing organized and get it going over the years, as well as all the other work you do with service agencies and others. I think I'd report to you on a couple of items tonight. One, I'd like to talk to you from the perspective of the board and just share with you that the organization looks very good right now. And when I talk about that, I'm talking about how's the balance sheet, how sustainable are we as we go forward and have to meet some of these challenges. And what does our earnings look like? Now, you might think, well, CCO, why have we been thinking about earnings? But it relates back to an old adage we've had in nonprofit healthcare for a lot of years, that if you don't have any margin, you're not going to have any mission. So part of what your board of directors tries to do is to be good stewards and to make sure that the different activities that the CCO is engaging in, first and foremost, meet our mission requirements. Are we doing those things that everybody feels is important? And secondly, and equally important, are we doing it in a way that's economically sustainable as we look out over the horizon? And of course, that's kind of hard to predict because things change so fast in healthcare, things change so fast in state funding, federal funding, and so forth. But I think I can report to you we're operating from a strong, stable position, and we'll continue to do so. The other thing we're looking at from a board perspective, and then I'll shift gears a little bit here, and also from a Samaritan Health Services perspective, are addressing what some people call healthcare determinants. Now, just a little bit earlier, you heard those different reports on pilot projects and how we're trying to do this and we're trying to do that and the other. And really, if you step back and take a look at it, what we're trying to do is change the culture and the way in which we do things as a community to make people healthier downstream. So it relates to some pretty basic things: dietary, exercise, education, training, job opportunities, to some very specific things like how do we address the homeless issue? How do we address the people that are really challenged with mental health issues in the community and make sure that they get access to the care that we'd like to see them have? And from a mental health perspective, I'm very pleased to report to you tonight something I was asked about by one of the audience members here earlier this evening, is that we will be opening up our first inpatient alcohol and drug rehabilitation center, hopefully by year end. Now, when I say we, just to clarify it, since we're on the record and she's got me taped and everything else, that's being opened and operated by Samaritan Health Services. But certainly, as Samaritan Health Services is a partner with the CCO, we're trying to mutually address a very critical need in the community, which is the rehabilitation of people. Not just the warehousing, if you will, not just the enforcement side of the question, but how do we actually get people to a better place and a better space? And you might be familiar with the building, the property. I can tell you about it now. It's the former Teen Challenge building over in Lebanon. So it was involved for many years in a similar type of mission. Our goal is to get the center open no later than the end of this year. Now, we got some work to do in there. We got to roll our sleeves up, and we got some remodeling, and we got some painting to do. We may even have some construction to do beyond the current capacity. But our goal when we get said and done is to have about a 15-bed residential care unit for men and women. Obviously, we'll separate out the two groups. But equally important, we want to make sure this is a coordinated effort with all of our partners. And this is where our interface with the CCO is just so very, very important, because it crosses all lines. It crosses the public sector, the private sector, the individual payer sectors, to where we're saying what are the resources we have and how can we best deploy them. Now, in the course of talking to you about rehabilitation, I obviously have to talk about something else, and that's detoxification. So when we first have these good people present to us, whether it's in a community location or a clinical location or an emergency room, oftentimes they have medical needs that need to be addressed immediately and to get them stable enough to begin that rehabilitation process. So the model that we have decided upon as a system is that we have an expectation and a requirement that each of our sites should be able to handle that immediate process, that immediate activity, so that if a patient does present to our emergency room, to our hospital-based locations, our expectation of them is that they'll have trained personnel, protocols, and methods in place that we can detoxify the patient to get them stable enough to get them put out into the rehab setting. The other thing we're doing is having some really great conversations with our other community partners, in particular law enforcement and the court systems, to say, okay, how can we fine-tune this to really get the maximum option out of it that we all hope for, which is a recovered person who is rehabilitated, able to enter back into society and to move forward in a positive direction. And one of the key factors that affects that, as we all well know, is how stable is the home environment, and certainly we have a lot of programs that are speaking to that. What is the housing situation, and what is their employment and economic opportunities to go forward? So it's kind of like we can't just, pick one thing off the tree and say, that's it, we're done. We have to look comprehensively about how do we care for multiple elements of it. So I anticipate we're going to be talking, certainly at the CCO level, I know we are at the Samaritan Health Services level, about how do we address some of these other critical factors and issues. And certainly the homelessness situation is a big factor there. The clinical ones I just spoke to, we're moving aggressively to look at that. And also the pharmaceutical question side, which Dr. Iwachina spoke to a little bit earlier. So there's a lot of activity going on. And one of the things I take comfort in, quite honestly, is the ability to sit down with all these good people frequently and talk about how are we coordinating our care. And like Ralph said, that's kind of the name. That's what we started with, is a coordinated effort, but we have to appreciate it's a community-wide effort, not an individual effort of any site, any agency, any organization, but a collective activity going forward. The other thing we're focusing on, again, from a system perspective, is access to care. In other words, we can have all these great, wonderful programs, but if you can't get in to see the doctor, if you can't get in to see the nurse practitioner, the therapist, or whoever it might be, it's not going to do you a lot of good. So here again, we're trying some innovative programs. One of the programs is to embed, that seems to be a term we all use nowadays, to actually place into our primary care offices mental health professionals. So these are people that are well-schooled and trained in how to identify and help work with the person who may be struggling, may be challenged by mental health related issues. And this is to support our practitioners, to give them a resource, if you will, that's there on a more immediate basis than trying to put that patient into the chain, if you will, of trying to get to a psychiatric setting or center, which really should be our last resort, not necessarily our first resort. So a lot of activity going on with mental health first aid, with working with the schools for early identification of kids that are at risk, a lot of work going on with a host of social service agencies to address some of the social and economic challenges that people have that really stress them out and make it more challenging. And then the last thing we're looking at, not the last, I hope there's many more we look at, but one of the other things I'll mention to you tonight is we're also going to go mobile. Now, when I say that to you, you might have all kinds of visions in your mind of what does going mobile look like. And the best way I can describe it is that, in a lot of our communities, we have buildings, we have structures, we have office buildings where our doctors are located, our practices are located. But in some instances, they don't have those types of resources. So this is another initiative that Samaritan's taken underway in. And by this July, our hope is that we're going to place our first mobile urgent care clinic setting unit out at Pioneer Villa near Brownsville off of the I-5 corridor. And this is kind of a test project for us. Now, one of the reasons I wanted to recognize the commissioner's presence here earlier is that when we want the commissioners to get authorization to locate this kind of mobile unit, which is really pretty innovative for our region, our community. They didn't skip a beat. They not only approved the concept we had about a modular one going forward, they kind of doubled down on us. They said, why don't you build it twice as big as you're thinking? I said, well, let's start small and build forward from there. But I'm hopeful right around the holiday season, you'll start to see these red and blue units. This will be a big one. It's about 53 foot long, so think huge, huge, huge semi-trailer, double expandable, so it will have one, if not two practitioners in it, med techs, nurses, and others who can directly intervene and provide care based on the needs of that site. So in some cases, it might operate like a doctor's urgent care center office setting. In other cases, it might act as an immunization center. In more extreme situations, it might actually go to a site for recovery and rehabilitation type operations. So we're trying to think, out of the traditional box to say, let's just go get more building stuff, to say, let's go to them and let's take our services out to the community rather than try to figure out how we're always going to get the community to us, because as Ralph said earlier, transportation is a big issue. So the closer we can get to them on a periodic basis, the better off we think we're all going to be. So that's kind of my update. Like I said, I think balance sheet-wide, earnings statement-wise, policy-wise, we're in a good position because of all of you and the great work that's being done by staff and volunteers. So Kelly, are you going to come up and lead us through the Q&A? Okay, I'm done. Thank you.